And that is especially true for substance use disorder, which often co-occurs with other mental health conditions. Dr. Durham, I'm sure that you're familiar with the data. Did substance use disorder and drug overdoses increase or decrease during the pandemic?
Thank you, Senator Warren. They definitely increased during this pandemic. I think at DPH in Massachusetts recently, for Black Americans in particular, 69% increase over the pandemic.
69% increase?
Yes, in Massachusetts specifically. That could have been from various, this is usually fentanyl-laced substances. Many times cocaine use disorder is pretty prevalent in some of the Black patients that we see, specifically at BMC. And so we could think of lots of things that happened during this period. What happened to everyone happened also to the folks we see who have substance use disorders, job loss, economic insecurity, housing insecurity, the loss of social supports. Substance use disorders are a remitting and relapsing disease. People sort of think at one moment in time you're sober and then that's it, but it's not. And so it's a chronic medical condition, and we should treat it as such.
So let me just push on this a little bit and let that sink in a little bit, that we saw a 69% increase in opioid deaths in Massachusetts. We were already nationwide losing tens of thousands of Americans to drug overdoses. And the problem has only gotten worse. And I think this is where you were headed. It has gotten worse differently in different communities. Mm-hmm. So you were serving on the front lines of this pandemic at Boston Medical Center, which serves many low-income patients and communities of color. As the coronavirus spread through Massachusetts and substance use disorder worsened, what patterns did you see in terms of the types of patients you saw at BMC, the types of communities that were affected? Can you just say a little more about that? I think that's where you were headed.
Yeah, sure. Well, we predominantly serve about 70% Black and Latinx at BMC, people that identify as Black and Latinx, and about 30% don't speak English as their first language. Just like many, I think many people were scared to come into the hospital at the beginning of the pandemic. And so I think what happened, though, is that we got high acuity as we hit December and January, where people coming in with severe, whether that be mental illness, but also severe relapse in whatever substance that they may have been previously using and maybe had stopped. I think poverty and job loss, like I mentioned earlier, health, access to healthcare in general, there was a change in that, right? We've talked a lot about telehealth, but it doesn't work for everybody. And so this is the particular population where I don't think it worked well for. You needed to be on a Zoom link with your recovery coach. Did you have access to a computer and to get the Zoom link and then have a smartphone? So I'll pause there.
So this is very helpful. So you've told us about the scope of the problem. You've told us about how it hits different communities differentially. Let's talk a little bit about the solution. In recent years, Congress has taken some steps, like passing the SUPPORT Act, to expand access to addiction treatment services, but it's clear that more resources are needed. So let me ask you, Boston Medical Center is a national leader in addiction and substance use disorder treatment, research, and training. Would a significant federal investment in substance use disorder prevention help lower overall deaths, reduce these disparities, and help support providers like BMC?
Absolutely. I think that we need parity in mental health and substance use treatment. I think we also silo substance use disorders from mental health disorders from physical health. The more we can combine all of that, because it's one person that presents, the better we'll all be. I do think that we need to start early with community outreach and more investment in the community. I think when we speak about Black and Latinx communities in particular, we need more research that allows us to partner with community-based services to do some of that research, because we're not targeting that population well, and we need to invest dollars to do that.
Well, I really appreciate it. We have an opportunity here not just to build back to where we were before the pandemic, but to drastically improve our public health infrastructure. I was very happy to see President Biden's commitment back as a candidate to invest $125 billion over 10 years in substance use disorder and the opioid crisis. And that's why in the coming weeks, I'll be reintroducing my Comprehensive Addiction Resources Emergency Act, or the CARE Act. This legislation would provide state and local governments the resources to combat substance use, to invest in biomedical research, in public health surveillance and professional training, and to expand access to naloxone. I am looking forward to working with my colleagues to get this done. I appreciate all the work that all of you are doing. I hope you can get better support from Washington to continue to do it. Thank you, Mr. Chairman.
Thank you, Senator Warren. And I believe what you and Dr. Durham